It's being called a game changer in the fight against fat. The FDA just announced a new weight loss drug shown to drop significant pounds and keep them off long term. Doctors at Scripps say Wegovy is part of an exciting new class of therapies being developed. Dr. Ken Fujioka from Scripps is joining us live this morning to discuss how this all works and why this is so different. Thanks for joining us, Doctor.
Pleasure to be here.
Let's start with Wegovy. What is this drug, and explain how it helps people lose weight?
Okay, so as you said, this is a whole different class of treatment that we've ever had. And think of it more as a hormone, not as a drug. And about 10 years ago, we finally figured out why it's so hard to lose weight. You know, somebody loses 5, 10 pounds, the body makes all kinds of adjustments to fight weight loss. And it turned out there were these certain set of hormones that were controlling it. We found those hormones. And it turned out when you lower this one set of hormones, it just stops your weight loss dead in the water. Well, guess what? They've been able to copy several of these hormones. This one's called a GLP-1, and it'll go up and it'll tell the brain it's okay to lose weight, go ahead and stop eating. And again, this is a game changer because all the other treatments we've had before will give you, maybe 5, 10 pounds of weight loss. Now we're talking 20, 30, 40 pounds of weight loss. This is a exciting time.
Yeah, exciting for sure, especially when you're talking about those numbers, especially for people really that have that extra fat they're trying to lose. 30, 40 pounds can really help out their overall health. So how successful has, products like Wegovy and these other ones you've been mentioning, how successful have they been in clinical trials? And then how does this compare to, say, bariatric surgery?
Great question about bariatric surgery, because bariatric surgery is the gold standard. You're getting 20, 25, almost 30% weight loss in patients.
Right.
And before, we were happy with 5% weight loss. In the clinical trials, and again, this is just giving it and seeing what happens, we're getting 15, 20% weight loss in patients. So now we're actually approaching the amount of weight loss that you get with bariatric surgery. So again, this is a whole new era that we never dreamed we'd get this kind of weight loss.
How are drugs like Wegovy and other similar therapies attacking the fat differently than all of the other weight loss pills on the market? How does it affect the body? You touched on it a little bit in the beginning of the interview here, but there's so many drugs that are out there. People want to know what makes this one so different.
Okay. Very fair question, because the older drugs, we were looking at really the side effect of weight loss. If you look at the most commonly prescribed drug, phentermine, it's a stimulant. It kind of makes you adverse to food, so you don't eat as much. And you'd get maybe 5% weight loss. This is different because it works physiologically. It works on receptors known in the brain that are supposed to be there and supposed to be fired off to help you lose weight. So humans are wired to eat 24/7. That's the way our brains think and way we evolved. And then when you eat a meal, food gets into the small intestine and you release hormones, GLP-1, the Wegovy, these new hormones coming out, goes up to the brain and signals the brain, hey, it's okay to lose weight, go ahead and eat less, go ahead and burn some fat. And this is moving now physiologically, because the other ones will stop. They just give you a little bit of weight loss and the body can fight it. This is different. You're giving back the hormone you need to lose weight. So all of a sudden we see 2 and 3 times more weight loss than we ever dreamed of.
And this isn't like something in the future. This is happening right now. In fact, Scripps is writing prescriptions for this right now. So someone watching this can do something about this today, right?
Yeah, I didn't dream it would happen in my lifetime as a researcher, clinician. This is now. And what's even more impressive is right now we got really good weight loss. I mean, we're talking again, we're right on the doorstep of bariatric surgery, but the newer ones that are coming out, which are all designed along the same principle, because it turns out there's about a half a dozen hormones going up trying to tell you to stop eating. So if you can give a couple of those at once, which is they've already made, believe it or not, and already tested, you get weight loss basically the same as bariatric surgery.
Incredible. If you're a viewer watching this right now and you're saying, look, this is what I've been looking for, you can reach out to Scripps. And also, we'd like to track your progress. We want to see how you're doing. If you're interested in sharing your weight loss journey with us to maybe inspire others, reach out to me. You can email me at econert@kfmb.com or message me on my social media pages. Because, doctor, people may not realize that weight loss, even just 5% of your weight, I mean, that can have major health benefits, right?
Correct. You're talking your blood sugar gets better, your blood pressure, your cholesterol, a lot of benefit.
All right, well, I look forward to this story, continuing this conversation down the road with you. Hopefully we can follow along a patient's journey, and you and I will be in touch on this, doctor. Some very impressive medicine that we're talking about here these days, isn't it?
Oh, this is really, for me, it's been my life's work for the last 20 years, and to see it actually come out now is just really neat.
Exciting time. So we'll be in touch, doctor. Thanks so much for your time.
My pleasure.